just joking that summer is a great time to eat, right?
It is the time.
Maybe too much.
Well, you know, barbecues are upon us, and we're really enjoying all kinds of new, possibly, fruits and vegetables. Should be eating more of those as well.
Yeah.
Getting ourselves into the fresh fruits and vegetables is what we should be doing, but some folks have a problem even with good food.
Right, and that's the sensitivities, and that's what we want to talk about today. Bryce Wylde joins us now to break down these sensitivities. How do we recognize them? How do we deal with them?
Well, if it's an allergy overt, the CDC actually reports that there's a significant increase of overt allergy carrying around an EpiPen. That's gone from 3.5 to nearly 5% in the last decade.
Really?
Absolutely, but a lot of folks suffer from sensitivities, and that's sending them more and more often to the doctor's office, and there really is a significant difference between allergy and sensitivity. And here's a bit of a breakdown of what those differences are. Take a look. Do you try to vary your foods in general?
Yes, exactly. And vary all my fruits and vegetables. I try to keep all my wheat products and bread down to a minimum. Although I love all that stuff, I just try not to eat as much of it.
Well, the incidence of food sensitivities affects about 1 in 10 of us is not quite the same thing as food allergy, that thing that causes rash and in some cases anaphylaxis, sending you to the hospital. But food sensitivities do in fact cause bloating, distension, sometimes depression, even weight gain. Strawberries is a great example of one of those things that some folks have an allergy to. But in the case of intolerance, we're talking about things like gluten, which is from wheat, barley, rye, or oats, and in some cases dairy. 52% of the world population is actually lactose intolerant. And remember, just because a food is healthy, like these beautiful looking strawberries here, doesn't necessarily mean that your immune system is okay with it.
Okay, so if you've got these sensitivities, what can you do?
The number one thing you want to do is talk to your doctor about it and find a naturopath or a healthcare practitioner who knows about testing, because taking some blood, beyond what an allergist will do is with a RAST, skin scratch test, take some blood and that could help identify food sensitivities. And by eliminating those, you could get rid of, you just heard me say, things like migraine, headaches, fibromyalgia, chronic fatigue syndrome.
And a lot of people don't know that the sensitivity is causing that problem, right?
Absolutely. And this could be from a good food, whether it's broccoli or otherwise, could be what's causing a problem with you.
Okay, let's talk about the supplement.
Well, there's a new kid on the block. It's called DAO, or diamine oxidase enzyme. And this one here, HisDAO. This actually works to lower the histamine in the gut that is formed through certain foods, even some that are as benign as bananas and beer, lowering the histamine in the gut. When your body should be producing this enzyme already, you can supplement with this, and by supplementing with this and lowering the histamine levels, you're going to significantly reduce the chance of histamine buildup and therefore this other type of food sensitivity that you might be dealing with.
Okay, what's it called one last time?
It's called DAO, or diamine oxidase, and this is an enzyme that helps to break down histamine in the gut.
Right. Okay, Bryce, thanks very much. That is City News alternative health expert Bryce Wylde. Thanks for joining us, and we'll be seeing you again shortly.